Hi everyone, I want to talk about dementia signs and symptoms. The clinical features mostly will have gradual onset, but can be very rapid in some cases, like Lewy disease, and I'm going to make a separate presentation on that. I've made a presentation on dementia with Lewy bodies already, and then the short-term memory will have problem. Then childhood memory could be intact until the late stage of the disease. If you check out my presentation on dementia that I've made earlier and published, you're going to find the 7 different stages of dementia. Instrumental activities of daily living function will become impaired, like shopping, using phone, can't remember the numbers of family members to type again on the phone, can't go to the bank and make transaction on self, transportation, cooking, and laundry will all become problems. And there's going to be impaired ability to carry out activities of daily living, like transferring from bed, bathing self, going to the toilet and getting self cleaned up, feeding self and dressing, all will become impaired with time. As the disease progresses, then all these will become problems in the life of the affected person. Clinical features will say involve cognitive impairment. They become confused, they become aphasic, that is, they have language impairment, and even talking will become a problem, like they have Apraxia, motor function problem. They become weak, memory loss, decreased concentration, lack of judgment, and they may be sleeping more than before, hypersomnia. Still, like I said earlier, it's supposed to be slowly evolving in majority of dementia cases, like Alzheimer's disease. But that is not the case with Lewy disease, because it's going to be very rapid within months. Progressive decline months to years, depending on the type of dementia you're talking about. But in Alzheimer's, yes, it's going to be progressive and slowly getting worse. Orientation is intact, but that may be disturbed in late stages, particularly orientation to person will still be there for a long period of time. No loss of consciousness here, no loss of consciousness. Speech is variable, but recent memory is not going to work anymore. Long-term memory, like I've just said, may be intact, but at the late stages of the dementia, that will become impaired as well. Okay, you can check Dementia 1 video for the 7 stages of dementia. The video also goes in depth on aggressive behavior. But we need to rule out delirium, because if it is delirium, it's going to be sudden. There will be impaired attention and orientation in delirium, and fluctuating level of consciousness, like I've just said, that there's not going to be loss of consciousness in dementia. But if it is delirium, there's going to be fluctuating level of consciousness. There's possibility of disordered speech, and memory loss in delirium is fluctuating as well, but it is consistently getting worse in dementia. There's possibility of major neurocognitive disorder, and to make that diagnosis, one of these may be present: learning or memory impairment, language impairment, executive functioning impairment, attention impairment, perception, social cognition, needs help with instrumental activities of daily living like banking and making phone calls and the rest. And we must have ruled out dementia and no major depressive disorder or schizophrenia. DSM diagnosis of dementia will give memory impairment in at least one of these. Aphasia, that is language problem, language impairment. Apraxia, motor function disability or impairment, while agnosia is the inability to recognize things. So impairment in all those three places must be present while making the diagnosis under DSM-4 and DSM-5. And there will be decline in executive functioning, significant impairment in social and occupational aspects of life, and we must have ruled out delirium. In conclusion, the clinical features differ slightly with specific diagnosis. And let me explain that further. You are not going to find every stuff that I've talked about from beginning of this presentation, the last 6 minutes, in all cases of dementia. Different types of dementia have some slight differences in their clinical presentation, and that will determine the mode of treatment as well. For example, dementia with Lewy body that will likely have features of Parkinsonism, and you cannot give first-generation antipsychotics in them, and Creutzfeldt-Jakob disease that will not evolve slowly but very rapidly and could lead to death within months is different from frontotemporal dementia, who will have major problem with manner, with behavior. No empathy, they are aggressive, they are agitated, and Huntington chorea, that is genetic, the history is in the family, is even autosomal dominant, they have movement problems, chorea, atetosis, balismus, and the rest like that. So you have to be sure, about what you want to do, because you need to know the exact diagnosis. So Alzheimer's disease is the commonest, and that is what many people are familiar with. But normal pressure hydrocephalus will present with dementia, and not even Alzheimer's. So we're going to go over all these different types of dementia very soon. I'll publish one on dementia with Lewy bodies, that of Creutzfeldt-Jakob disease, frontotemporal dementia, Huntington chorea, normal pressure hydrocephalus, Wilson's disease, vascular dementia, HIV, dementia complex, all will be published very soon. Kindly subscribe to my channel, and you'll get these publications immediately they are released. Thanks.